Chemobrain, depends again, depends on the intensity. If these patients have received just the chemo or along with the chemo, they have received radiation. So the symptoms can vary from person to person. So helping, there's a lot of talk around, difficulty with concentration, that is the attention. In our therapy terms, we talk about attention, which is the foundation skill. We help people to develop that attention. They experience some kind of like a fogginess in their brain. They are not able to focus, and they're not able to remember sometimes things. They are not able to problem solve. So there are different levels of cognition, cognitive skills that are impacted. Now, what is cognition? Just giving a little blurb on that. So cognition refers to a thinking skills. Anything we need to do to remember things, pay attention, how our judgment is, how we problem solve, all those big things, executive functioning. When we go back to work, multitasking becomes difficult, and that is what these patients are experiencing. I do have one patient who is going through that kind of a situation right now, and sometimes he has problems with finding the words. So all these areas, so addressing specific areas in during our treatment sessions can help that. The most important strategy that I usually tell patients, have a daily routine. Set up a routine for yourself. Do as much as your body can handle. Respect your fatigue level, but definitely do a little bit at a time and get back to things that you enjoy the most. There are women who, go through the breast cancer surgery, or, they go through radiation or different, things. There's an energy level. So learning to, having energy conservation, but find out what time works best for you. Are mornings better, or you work better in the afternoon? Find that and balance yourself. Do things that you can enjoy. Participate in family gatherings. Again, with the COVID situation, we cannot have big meetings or anything. But just as simple as I encourage all my patients to sit even for lunch or dinner with the family, instead of sitting in a bedroom or sitting alone and eating food. It's not fun. Be part of the family. And many times I encourage the family members to involve the patient or the person who is going through this in the decision making. Many times what happens with these situations, the family just takes over everything, and the person is not involved with any of the decision. So encouraging, involving the person to be with their care, and just not taking away everything from there. It feels like the patients, they have reported that everything has been snatched away from me. So it's very difficult for this person. It's just not emotionally, physically they are not able to handle, and then the chemo affects a lot of different areas. So respecting that and letting the person do a little bit at a time, and just not making them dependent. So that is in a nutshell. I've done an article. It has not been published yet, but preventing learned dependency. So of course it's related more to the stroke, but it can be to any diagnosis. So yes, we can decrease the amount of effect it can have by a little bit of pacing or planning. Let's say, if I'm having difficulty remembering things or focusing, I sometimes encourage patients to have a little pocket book, and they can take notes. Difference, in the home situation, things are not challenging. But let's say if the person has to go back to work, they are not able to cope up with the multitasking. If the patient, has very high level of functioning that he needs to, he's managing people, I encourage patients, do not take verbal instructions in passing by. Always no verbal instruction, get them to send you an email. That's kind of a reminder for them. It's like a memory strategy also for them. When the phone is ringing, sometimes patients have difficulty with the word finding. I tell them, let it go to the voicemail. Don't pick up the phone. Wait till you hear exactly what the message is about. take notes before you respond to them. If and sharing some of the difficulties they're experiencing with somebody at work, and say, I'm not to the point where I was before all this happened, but help me. I want to go gradually, building up that energy level, building up that confidence level, because one error, sometimes people look at you, very closely, and they think that you don't have those skills anymore, which is not true. The effects of the chemo can go down and you start feeling better and you can handle more. So, again, energy conservation and understanding how it is affecting you. And then holding, those little things in place that will help them. Memory is a big one. Attention is a big one. And memory and attention go hand in hand. If you did not pay attention, you're not able to remember better. So, things don't change, especially with the brain, tumors when they're removed. Again, depending on the size and the location, some of the patients do experience changes in their vision. They have blurry vision, they get a field cut, that means, loss of vision in one eye. So they have to work double, that means, the eyes have to focus a lot more because the part of the vision is missing in there. And that is due to the brain surgery. So depending on the location, the extent of surgery, strategies can be put in place, but understanding that things have changed, accepting and adapting to it will help them with their recovery process.